we've been getting some letters and notes and questions. Finally, I'm going through some email now that I'm back in the swing. One of the letters is from Sally, who found out that her husband, who has Parkinson's, has been unfaithful. She's livid, of course, hurt. And I'm noticing that this is not a moral issue, it's a health issue for Parkinson's patients. That's not a hall pass. I'm just saying that the dopamine agonists that we're on that make us able to move and to function, keep the mood lift happening, are also tied up with our pleasure reward. So movement and pleasure reward are tied together. These are the strongest human impulses. And if you are experiencing a proclivity for gambling or a sudden hypersexualization or buying lots of shoes, I don't know what that would be like. You may have to check your dopamine agonists, which can cause impulsivity and compulsions. It's very important, once again, not to moralize this issue. I'm not saying that it doesn't also come into play, but get therapy, talk to the doctor, check the meds through a medical professional before acting out. It's not an even playing field. It's not, if this happens, A happens, that means B and C. That's not how it works with Parkinson's. That's why I always say keep things in context. So may you be well, and I hope you get some therapy and figure out the meds, first and foremost. Second question came from someone named John. His wife has become suspicious, belligerent, and skeptical about everything. She's just really difficult to talk to. Suddenly, and immediately my reaction was, check for a bladder infection, check your meds. But of course, my real reaction is, make sure you talk to a medical professional, talk to your doctors immediately. That's a question for your doctors. But I do believe that those are signs that something's wrong chemically, if those are new to her personality. Is she on any new meds? Has she had any med changes? Any changes in her health? Really do run the gamut, blood work. Again, check for the urinary tract infections that can change people overnight almost. It's really wild. I've seen it myself. So, and I'm sorry about this, because that's really painful to have your loved one change like that. I've had people change without any meds changing at all too, so you never know what's going on with someone. It's a good time to have a nice long chat and to do this maybe with a mediator or with some medical help. The third question came from a family member of someone who's worried about his mom, who's been sick, doesn't like to come out of her room, seems to have lost her lust for life, like she doesn't have any excitement. Apathy is rather, it's common with Parkinson's. After you reach a certain level, you have less movement, you feel isolated, and you also get a little depressed or maybe anxious to the point where you don't really want to leave your room or your house much. Get your mom involved in some activities that are a little out of her comfort zone. That's going to be hard to do. You might need to enlist some other family members. You can also talk to your mom about things that you know are exciting and joyful to her, and keep bringing them up. Have her taste new foods. Ask her for her help and opinion on things. Feeling useful and having a purpose is a big deal for someone who's disabled and or with chronic illness. Just some ideas. Again, always talk to your therapist about this, talk to medical professionals, and have long discussions with your family. It's better to talk directly to the person than to speak about the patient in the third person or to triangulate and talk about them outside. First, go to them. Go to your mom, have a long talk with her, tell her how you feel. Make sure she knows you love her and that you're not judging her. Parkinson's, when it reaches certain stages, is really difficult to explain, even if you have it. So thanks for listening, and I hope something that I gave you here today was helpful. Thanks for writing me. And as always, when I return your letters, I'll give you my phone number, we can talk. Thank you, I learned from you too.